I think there's some nurses who might not have been as
Hands-on.
generous with their care, you know.
And the mailman walked up the steps to knock on the door and say, your little girl is downstairs with no clothes on. One of the most important things that residents should learn is to listen to the nurses.
Joining us today we have Pat. She is a retired nurse. She's got a lot of interesting stories to share. Why don't we just get into it? So tell me a little bit about your upbringing. How was that? How was your family?
I was born and raised in Pittsfield, Massachusetts, and I lived there till I was 18 when I went to nursing school in Albany, New York, which was only 45 minutes away from Massachusetts. I have two brothers and a sister, and my parents. My father was a Marine, and then he served in the National Guard and retired from that. And my mom worked at Price Chopper, a supermarket up there in the Northeast. My upbringing was pretty good, I thought, actually. I always felt bad that my children would not experience playing in the snow, so they just had to play in the sand at the beach instead.
What was your favorite part of being raised in Pittsfield?
That was a long time ago. So my favorite thing was actually probably the change of seasons, which we don't have as much in Florida. Fall happens to be my favorite season, and it's beautiful in New England. And I was interested in swimming. I was like an assistant swim instructor at the girls' club in Pittsfield, which happened to be right across the street from my high school. So I would walk across the street and help out with teaching kids how to swim. So that was fun.
Okay.
And worked as a candy striper, which I don't even know if they still do that anymore, but a volunteer in the hospital, learning about hospital work.
Why do they call it a candy striper, do you know?
The uniforms that we wore were pink and white striped, so they kind of looked like candy.
Can you think of any funny stories from when you were a kid? Anything you'd want to share?
I don't remember, but I remember stories about my mother. We lived in a duplex that was not side by side. It was one on top of the other, and we lived on the top part. And so she would tie me outside and tied me outside in, I think, February is what I remember. I mean, I don't remember, but that's what I remember of the story.
How you've been told, I guess, yeah.
But tied me outside there, and the mailman walked up the steps to knock on the door and say, your little girl is downstairs with no clothes on in February in Massachusetts. So
oh my goodness.
It was a little chilly, I think.
Yeah. But somehow I guess you were no worse for wear. Is there any interesting school-related stories that you might have? Elementary
School, apparently, I was a bit of a talker because that's what my mother would always hear at open house was that we just need her to stay in her seat and stop talking, coming up to the teacher and talking. So I don't know if it was because I was getting my work done before everybody else or what, but I guess I have the gift of gab, my Irish ancestry.
Okay. Anything as far as middle school and high school extracurriculars? Or
middle school,
stories?
I was interested more in like cheerleading, but in high school I was very involved in theater arts. Oh. As a pantomime.
Okay.
And
what was that about?
It was just something that I guess the theater arts teacher thought was interesting. Mm-hmm. And,
but when you say pantomime, that's kind of like miming, like your typical French mime that might come to mind, and you're using your hands to put up a box and things like that?
Yeah, exactly. And so not talking.
But were you doing like whole dramas in that way, or was it more like just like a spectacle, like for a minute?
No, it was, we did whole skits, and when I graduated from high school, we were close to the bicentennial of the United States, so we actually toured around the state.
Let's move on a little bit. Let's go into the college era.
It was not college per se like people think about college now, because it was in Albany, New York, and it was for nurses. It was a training school for nurses. Yeah. So
kind of like vocational study.
Yeah,
kind of
but
thing?
we pretty much staffed the hospital. I don't know what they would have done without the nursing students, and it was a lot different back then. That was the good part of this type of a program, was because when any of us graduated, we knew how to be a nurse. We knew how to take care of patients, and that's kind of lacking, I think, in a lot of the programs today. They're more focused on book learning than they are on the practical side. And it's really the practical side that sharpens your skills, your observational skills, your assessment skills, and whatnot. So it's kind of sad that no longer exists, that type of a program. We were not without our instructors either. I mean, our instructors were always on the floor, and there were always nurses, registered nurses who supervised us and were there for our, like if I had a question or a concern, but they trusted us because we learned on the job. That was experience that you can't replicate in a classroom.
So how does that timeline look? So you said you were in Albany?
Yeah, Albany, New York.
Okay, so you finished school.
In 1978, and then I worked there, I'm trying to remember, probably 1981, I moved to North Carolina, and that was coming from New England and being born and raised as a New Englander was quite a culture shock to move to North Carolina, where people would talk to me in line. And I'd be thinking to myself, who are these people and why are you talking to me? I don't know you and I don't want to talk to you, really.
I guess that's the Southern, hospitality kind of.
And it was kind of shocking, and because I was a New Englander, and we're very, New Englanders are very arrogant, maybe. I kind of looked down on these people who were maybe doctors or whatever with a full-on Southern accent. They always sounded kind of dumb to me. I mean, after many years, I realized that was not true.
So you were like a stuck-up Yankee, is what you're saying?
Yeah, kind of. Well, they say the difference between a Yankee and a damn Yankee is that the damn Yankee won't go home.
So how was your experience after you finished college? What did you go? Did you go straight into the workforce, or?
Yes, I worked as a nurse.
Mm-hmm.
And
what was your specialty?
My specialty in nursing was critical care. Including cardiac catheterizations back in the day, in the early, probably the mid-1980s, was kind of when angioplasty started, where they would blow up a little balloon in the heart to open up the blockage, and that was that was a new thing, and it was a big deal back then, because now patients you could prevent them from having open heart surgery by just doing this much simpler and much less invasive procedure and saving their lives. So that was important job to me.
So speaking of nursing, can you recall any interesting patients, or you have to have a bunch of interesting medical stories?
I can remember one time, actually when I was in nursing school, the nurse's residence was attached to the hospital by a tunnel. And so if you walk through that tunnel, you end up on really kind of like the basement of the hospital. And the operating room was right there. And I can remember it was a very busy emergency room. And it was a trauma center and all that kind of stuff. So I can remember one of the nurses in the emergency department, and coming down the hallway, she was kneeling on a stretcher with her finger in the patient's chest was open and her finger in the heart because he was shot, and to keep him from bleeding out. So that was pretty dramatic. So we saw things like that. I took care of many pediatric cases with congenital heart defects who were corrected, and it was weird because at the end of my time there, my assessment of that was that either they came back to the unit after surgery awake and sitting up and playing on the stretcher, or just completely, they ended up dying pretty much. So I mean, it was that much of a difference. So it was very dramatic, and sometimes patients like that, it took 2 nurses to take care of the patient because they were just that sick. And I rarely remember that happening with adults, but with children, it was a very different story. My least favorite was neurosurgery kind of group, mainly because they didn't lie still in the bed, and the bed would get all messed up, and that would make me upset. But also, you just never know with a neuro patient, like a closed head injury or whatnot. I can remember, I think he was like a senior in high school. Somehow, I can't remember exactly how, but he had a traumatic brain injury, closed head injury. And for the first few days, we all thought he was going to die because of, his condition and the way that his body was responding to the closed head injury. And, you just kind of didn't recover from that. And sure enough, he did. He recovered from that. And then he got progressively better over a couple days. And I can remember that it was a 4-bed room, and I wasn't taking care of him that night. I was on the other side of the room, and but he kept asking for his to see his parents and his friends, and so they all came in. And within an hour after they left, he essentially died. He coded, and we couldn't get him back, and he died. And he was only like 17 years old. Yeah. And that, to me, it was something that I just couldn't deal with that kind of thing. I remember a pediatric patient too, he was 3 years old, fell and hit the back of his head on the edge of the coffee table and suffered a bleed in his brain. And I can remember, I could still see the kid laying in the bed. And I was not a new nurse, and I knew enough to know that this kid was not doing well, but I was standing there and I was like stroking his leg, and he pulled his leg away, and he had been having no response at all. And so I ran out to grab one of the neurosurgeons, and he's moving, and he said to me, "It's just reflex." And I was heartbroken, and he did die. He died, and I can remember going to a mall in that area, and his parents were there, and they remembered me because I took care of him for most of the time that he was there. And I didn't know what to say. It was awful.
Did you talk to them at all, or?
They were happy to see me, but I felt like, we failed. So.
Yeah, well, that's why they call it medical practice. Mistakes happen.
You know what? I will say that one of the most important things that residents should learn is to listen to the nurses, because it's the nurse who's at the bedside.
Yeah.
24/7. They're there for maybe 10 minutes.
You guys are in the trenches. Yeah.
And also, and that being said, to nurses as well, to listen to the families. What do we know about what's normal for this patient? We don't. The family does. I mean, oh no, he doesn't look right. No, this is how he always looks, or this is how he's not acting right. Listen to the families, because they know this person.
How about any interesting, funny, crazy, bizarre medical situations that you've been in? Or?
After I worked in the open heart unit, I worked for like a year on a locked psychiatric unit, and that was really interesting. But we had I remember back then it was when like bulimia and anorexia were first being recognized as a psychiatric or mental health issue, and so we had one girl who was anorexic, and so it was somebody's assignment to sit with her at dinner, because otherwise she would tend to sit next to the garbage pail in the dining area. She'd distract you, or if you were distracted, she'd throw her food in the garbage. So we, when we caught on to that, because they wanted her to gain so much weight before they would discharge her. And she slapped me upside the head with a slice of tomato one day.
Oh my goodness.
Yeah.
Any other funny or bizarre cases you can think of?
My husband was in the military, and he was stationed in Missouri, and I worked at a hospital there. And I apparently I had had many years of intensive care experience at that time, but it wasn't in the elite group that could have worked in the intensive care unit there. So I worked in the step-down unit. And back then it was team nursing, so you had like a whole hallway of patients. And it was me and an LPN and nurse's aide that had this one team. And we had a patient that was very young. I think he was probably maybe 30, 31, who had been just transferred out of intensive care after he had attempted suicide by overdosing on insulin, which the problem with too much insulin is if your blood sugar goes very, very low, your brain can't tolerate that. And glucose is what makes your brain work. And his blood sugar, when he came in, was very, very, very low. And so he was essentially comatose for I don't know how long. And but finally was stable enough to be transferred out, but his brain was still fried. And so we walked down the hall and kind of just counting heads. I went in to check on him because, he was a new transfer from intensive care, and he was sleeping. He had a Foley catheter in to drain his urine. And so we went and, just did our initial head count. And when we came back down the hall, he wasn't in his bed anymore.
Uh-oh.
So I was a little concerned about that. So I went in the room and I opened up the bathroom door and he was sitting on the bathroom floor pulling on the Foley catheter. And I'm like, don't pull it. Don't pull it out. I'll be right back. I'll take it out. Just don't pull it out. So
Is it designed in such a way that it
there's a balloon.
hooks?
There's a balloon at the end of the catheter that keeps it from falling
Coming out
out
accidentally. Yeah.
Yeah.
Okay.
So you don't want to pull that balloon through your urethra.
Sounds painful.
Yes, it usually is. And people are usually confused when they do it. So anyway, so I went and retrieved a syringe so that I could take the water that expands the balloon. So I could take it out, and then the balloon is deflated. I can take the catheter out. So I took the catheter out, and bright red blood was pulsing from his wee-wee.
The PG version there.
And I was like, wow, I've never seen that before. I'm thinking to myself in my head. And there was a urinal there, and I put the urinal in there, and I'm like, okay, this isn't good. And so what's the first thing that you do when somebody's bleeding from an artery? you apply pressure.
Oh my goodness.
So I grabbed that weenie and held on for dear life and called for the LPN who came in the room and said, "What are you doing? what are you doing?"
Oh my
I'm like,
goodness.
"What does it look like I'm doing?" And I told her, what happened, and she's like, "I don't believe you," like, because she had never seen it either. And so I let go, and with bright red blood again, and I grabbed it again, and then she got the message and ran out.
Meanwhile, what is the guy doing? Is he just sitting there?
Yeah, he's just sitting there because he was fried, but he had a
Yeah.
smile on his face.
Oh man.
Anyway, so I told her, I said, "Call the resident." So I'm sitting there 10, 15 minutes, holding pressure. I'm like waiting. Finally, I get him back in the bed, and now it's stopped. And I go out, and the residents sit there, laughing. I'm like, he says, "It wasn't blood, it was urine." I said, "Really?" Walked it back to the urinal, picked up the urinal, brought it down with a 200cc clot in there. I said, "Does urine clot?" And then he had a whole different, "Let me call the urologist."
Yeah.
Yeah, that sounds like a good idea.
Yeah, it took you long enough.
Yeah, so that when the urologist came, he said that in all likelihood what happened is when they put the catheter in, it nicked a small artery in the urethra. And because catheter was there, it was tamponading. It was, it wasn't bleeding at that point, but now that he was pulling on it and we removed it, it started again. So at least the urologist believed me.
Well, a good thing for him that you were there, because I think there's some nurses who might not have been as
Hands-on?
generous with their care,
As hands-on?
Yeah, as hands-on for sure.
Well, I mean, I don't know what else you would have done.
Yeah, you didn't
Really?
really have a choice at that point.
Yeah, but I knew damn well that my patient was not going to exsanguinate
Yeah, not on
from the wee-wee. That was not going to happen.
Let's keep moving on. Maybe some tidbits of wisdom that you can share with people who are interested in the nursing field.
I've been a nurse for almost 50 years now. So my first 20 years or so was at the bedside. And then the last half of my nursing career was as a risk manager, a healthcare risk manager, which has to do with patient safety and legal, litigation, medical malpractice cases and whatnot. Like I said before, one of the most important things that you can do is, as a nurse or as anybody actually, physicians, respiratory therapists, anybody, is to listen to the family and, look at the patient and don't assume that something that is not normal for that patient is normal for that patient. That, in other words, if the family's telling you that he's not acting right, or he doesn't look right, or she doesn't, something's not right, to listen to that. I tell in all the years that I've spoken to, like, either nurses being oriented at a facility, new nurses coming in. One of the things that I used to say, and this is true, is that nurses must have common sense, which we know is pretty much in short supply anymore, but, and you can't teach it. It's something that you learn. A good nurse has uncommon sense, and that we're very highly trained observers. That's what we get. That's what we're there for. In this, I don't think I could go back to the bedside now, because it's just ridiculous the amount of paperwork that's required, and check all the boxes and do this. You're not doing the patients any good, because you're there to observe and to assess and to respond to changes in the patient's condition and whatnot. And one of my pet peeves was always, now we have to have electronic healthcare records. Unfortunately, most of them will allow you to cut and paste, or it will you know, from the previous shift, it'll populate an assessment or notes, you know, canned notes that most people are not looking at again to see whether or not anything's changed. So in my experience as a risk manager, I'll give an example of a patient who was morbidly obese and fell out of bed at her home and laid with her leg up in the air for like hours. The mother came and found her, and they brought her to the hospital, and she developed something called rhabdomyolysis, which is the breakdown. Essentially, it's your muscle is breaking down. It affects your kidneys, all kinds of stuff. So it's a very serious condition. Well, the hospitalist who was taking care of her for essentially the entire week, and nursing staff as well, were repeatedly charting that she had good pulses in her leg, that her leg was warm and dry, that it was pink, and blah, 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 blah. Until, like I said, I'm not sure, maybe day 7, at bedside report, the oncoming nurse actually lifted the sheet up and saw that her toes and half of her foot were black.
Oh my goodness.
And that did not happen overnight.
Yeah, I can imagine.
That happened over several days. But she ended up losing her leg. There was nothing that could be done at that point because it was gangrene. But there would have been no defense for that case if it went to trial, or if it went to, you know, you might as well just write the check because you couldn't defend that.
So what you're saying is, if you're a nurse, don't take shortcuts.
Don't take not even if you're a nurse, if you're a doctor, if you're a respiratory therapist, if you're anybody who has direct patient contact, imagine that it's somebody that you love, you know, because they belong to somebody.
Them.
They belong to somebody.
Yeah.
And, you know, don't ignore signs and symptoms that are like ready to hit you over the head. I'm having a heart attack, or, you know, whatever.
Yeah.
They're just, and it happens all the time, unfortunately, because everybody is rushed. Staff is too, you know, there's not enough staff. There's not enough nurses. There's not enough doctors. It's difficult. It's a very difficult job.
We appreciate everything that you did. Wish you the best, Pat. Thank you.
Thank you.